guys, welcome back to another tip of the week. This week I want to discuss a product that's going to be useful to a lot of you, especially those of you who like to use products like this and like this. I'd love to say I'm immune from that, but most of you know me and you know that's not true. So today I want to discuss how to pick out a great mouthwash or a great mouth rinse specific to your needs from your local grocery store or your local pharmacy. Life is tough. We have lots of opportunities to have sugar, lots of opportunity to eat candy, lots of opportunities to damage our teeth. And willpower is something I struggle with. So I'm always looking for those extra products I can add to my daily routine and my home care routine that are going to reduce my chances of having to have Dr. White drill holes and fill my teeth. What I'm recommending today is just kind of general purpose over-the-counter use products. And really, if you're not struggling with the health of your mouth, they're products you probably don't need. But if you're somebody who's getting cavities on a regular basis, or there's lots of inflammation in your gums, or you're battling periodontal disease because you have a lot of risk factors for periodontal disease, these products really could make a big difference for you. So the one I want to start out with is a product that I use for myself personally, because I do have an affinity for sugary sweet treats. And so what I want to do is I want to reduce the amount of acids in my mouth throughout the day and try to increase the pH and remineralize my teeth as much as possible. When I brush my teeth at night, I leave the toothpaste on overnight. I don't rinse because toothpaste is sticky. So in the morning, after I brush my teeth, I do rinse because I don't want to be frothing at the mouth when I see all of you guys when you come smiling, bright-eyed, bushy-tailed for your hygiene visit. So instead, I use a mouth rinse. I also like to refill little bottles like this throughout my day with this product. So every time I have a drink with sugar in it, I drink a lot of coffee. Sometimes the coffee's sweetened. And sometimes I have snacks because some of you guys have been known to bring me really awesome treats. And I have a really hard time not partaking. So I like to follow up with these when I don't have 2 minutes to brush. I can just run back into my office and have a little swish of one of these products. And when I'm out and about, and I usually do that from one of these little bottles that I refill from one of these big bottles. Act is the brand most people are familiar with. But better bang for your buck. If you look right next to Act, you're going to find another mouth rinse that has the ADA seal, which allows you to know they have good pH, good chemistry, and good last. Now, for those of you who are at high risk for gingivitis, periodontal disease, people who develop a lot of plaque and calculus, like people who are uncontrolled diabetics, people who are struggling with their blood sugar, people who are smokers, mouthwash is going to be a better product for you. You're probably not somebody who's getting cavities a lot unless you're one of those really unfortunate people where your mouth goes on a roller coaster of pH. And so really what we want to do for you is control the bacteria that contribute to those conditions. And so mouthwash is designed to kill bacteria that's pathogenic. And so the product that most of you are familiar with is Listerine. Listerine is designed to kill all kinds of things and supposedly soften plaque and calculus so it's easier for you to remove. The active ingredient in Listerine is alcohol. It's got a pretty good alcohol content to it. Not the kind of alcohol that's going to, make you have a interesting date, but the kind of alcohol that's really good at killing bacteria. The same reason people have used alcohol to disinfect things for years. So Listerine is a product that you can see has the ADA seal, so we know it kills bacteria well. But nowadays, people are tired of feeling their mouth burn because it's dissolving when you have alcohol in it. And so we have non-alcohol mouth washes. And the non-alcohol mouth washes are also designed for people who get dry mouth because alcohol mouth washes will dry your mouth out more. And so this is a great product. It doesn't have an ADA seal, but this is a product I've used in the past just because I really like the way it tastes when I want to freshen my breath in between. I'm not struggling with a lot of gingival inflammation or periodontal disease. So it's a product I've just used because I've had a lot of easy access to it. So if you are somebody who has one of those struggles, and you're going to be using it during your day, you're going to use it a little bit differently than mouth rinse. What I would like you to do is before any brushing activity, morning or evening, is to swish with this for 60 seconds before, because we're going to remove a lot of that bacteria before you brush and hopefully soften the plaque so it's easier for you to remove. And during the day, when you do things that you know contribute to the bacteria that are pathogenic in your mouth, you can carry around a travel-sized bottle of mouthwash to help minimize the chances of you getting more inflammation. So if you're a smoker and you're going to smoke, following it up with mouthwash would be great. So my homework for you guys today is to go out, think about what you're experiencing in the dental office. Do you get a lot of cavities or are you more focused on inflammation? And pick one of these products. Make sure it has the ADA seal on it. buy a value jug, think generic, think large, think value. And then I want you to pick up a travel size bottle. It doesn't have to be a travel size bottle of mouthwash. It could just be one of those empty travel bottles you pick up for going to the airport. And I want you to refill it and use it this week and see if it makes a difference in your home care routine. If you guys have any questions about mouthwash, mouth rinse, or how you should be using it, please give us a call. We'll see you at your hygiene visit. We want to make sure, again, that we're getting you that specific customized home care plan that helps you stay out of my dental chair, helps you come in for things that are more important to you, like elective care. Thanks for listening, and we'll see you next week for another episode of Tip of the Week.